Lucid dreaming, fact or fiction? About 1/3 of our lives are spent sleeping, and dreams are an integral part of our every night's sleep. Let's peek inside someone's dream. As Elisaveta wanders through her dream, she comes to the realization that the time period she is in does not align with the one she knows to be true. Suddenly, she realizes that she is not in the real waking world, she is in a dream. What Elisaveta just experienced is called lucid dreaming, a phenomenon in which the dreamer becomes aware that they are dreaming while they are asleep and may be able to influence the course of the dream. This phenomenon has been reported since antiquity. The earliest references can be accredited to both Hindu and Tibetan Buddhist practices, which date back millennia. Meanwhile, in the West, since the time of the ancient Greeks, lucid dreaming has gained popularity. Despite the fact that there are many references to lucid dreaming in literature from around the world, during the past few decades, the validity of lucid dreaming has caused debate among scientists due to the lack of conclusive scientific evidence. This all changed in the late 70s and early 80s when the first objective studies of lucid dreaming were published. As a result, lucid dreaming gained increased acceptance as a legitimate phenomenon. Previous research findings demonstrating that the physical eyes can often trace where the dreamer is looking allowed scientists for the first time to record lucid dreaming in real time. They achieved this by developing a technique which consisted of instructing dreamers to move their eyes in a predetermined sequence of left-right eye movements, which were then captured using an electroculogram, EOG, during REM sleep. This would allow the dreamers to signal from the dream world to the waking world that they were lucid. In sleep, polysomnography is a test used to record physiological parameters such as brain activity, EEG, or eye movements, EOG, during sleep. You can see in this polysomnography recording that the left-right sequence stands out from the rest of the EOG signals. This indicates lucidity. The volitional eye movement pattern technique became the golden standard for later studies. While the majority of studies demonstrated that lucid dreams typically occur during REM sleep, some studies also demonstrated that they can occur during non-REM sleep. In a typical sleep cycle, we have two main types of sleep, REM and non-REM. Non-REM sleep is subdivided into 3 stages. As we go from non-REM stage 1 to second stage, our heart rate, body temperature, and brain activity starts to decrease. Stages 3 and 4 are often referred to as deep sleep, which is characterized by a slow wave pattern. REM is a stage of sleep in which the most vivid dreams tend to occur and is characterized by rapid eye movement and increased autonomic activity such as heart rate and blood pressure. But what are the brain regions associated with lucid dreaming? In a case study using fMRI, which is a type of neuroimaging technique used to obtain images of brain activity while performing a task, scientists reported neural mechanisms of dream lucidity. In the waking state, the subject was asked to clench his hands. This lit up key regions of the brain on the fMRI. Then, the participant was instructed to fall asleep and dream about clenching his fist, and found that similar brain regions lit up in both circumstances. They found that lucidity was associated with the anterior prefrontal cortex and parietal regions, which are generally inactive during sleep and are known to be involved in executive attentional cognitive function. However, since it's a case study, we can't generalize the findings. Another study, which examined individual differences in lucid dreamers, found similar networks of brain areas. It seems that only around 20 to 30% of the population are actually natural lucid dreamers. This does not imply, however, that the remainder of the population cannot have lucid dreams. There are methods that have been developed to induce lucid dreaming. One approach involves using transcranial direct current stimulation, or TDCS, a type of non-invasive brain stimulation that uses small electric currents to stimulate your brain. Some evidence has shown that this method can increase the frequency of lucid dreams. However, more recent replications show no such results. Another method involves using a pharmacological approach. Some studies have shown that galantamine, a medication used for Alzheimer's, can intensify REM sleep and therefore lucid dreaming. However, the most effective techniques known to induce lucid dreams are cognitive behavioral approaches, from which there are numerous techniques. Mnemonic induction of lucid dreams, or MILD, one of the most widely used techniques, involves the dreamer rehearsing the dream and visualizing becoming lucid in it, while setting an intention to remember to recognize that one is dreaming. Wake back to bed, or WTBT, is a technique that involves setting an alarm to wake you up after 5 hours of sleep, staying awake for a bit, and then returning to sleep so that you can enter REM while still conscious. Reality checks, such as checking to see if your finger passes through your palm while dreaming. Combining these techniques increases the likelihood of lucid dreaming. What can lucid dreaming be used for? For entertainment, skill rehearsal, creativity and problem solving, and additionally, studies have shown that lucid dreaming can also help treat nightmare disorders.